fenestrated and branched endografts. There's a way that we could treat complex aneurysms 100% with stents, so totally by endovascular means, avoiding any incisions or open surgery. We're reserving this technology for the highest risk patients that don't have any other options. A lot of these patients have many comorbidities, other medical problems, bad heart, bad lungs, bad kidneys, diabetes, high blood pressure, etc., and it puts them at a high risk for the traditional open surgery. While the patient's getting prepared on the operating table, I would create this graft based on the CT scan measurements for that patient, because every patient has their own specific anatomy, so every graft has to be custom made for each patient. So you can see that the stent is made up of polyester fabric and metal, and it goes inside the patient's aorta as a sleeve, if you will, excluding the aneurysm from blood flow. The difficulty is if the aneurysm involves the kidney arteries and the intestinal artery, for example, and you put that stent inside the aorta, you'll end up covering those arteries, and therefore they won't have blood flow and those organs will die. So in order to preserve blood flow to those kidney arteries and the intestinal artery, what we do is we create little holes in the graft and then align up those holes with those arteries, and then through those holes we could put stents in. The first question would be, where is my aneurysm? Does it involve my kidney arteries? Does it involve my intestinal arteries? Is it in my chest? Is it in my abdomen? How big is my aneurysm and what's the risk of it bursting? How can it be fixed? So open surgery or stenting, are stenting procedures available? And then what are the risks with both of those procedures? I think ultimately as the technology evolves and the technique becomes more widespread, that you'll see it applied to patients who are at good risk too, because the results will be superior, particularly as the years go by and we learn more about the durability of this procedure. I think there'll be, in 5 to 10 years, hardly anybody will be having open surgery anymore.